Hello and welcome to today's webinar. My name is Peter, your WebEx producer, and I will be in the background answering any WebEx technical questions. We have a few housekeeping items before we get started. If you experience technical difficulties, please send a message to the WebEx producer using the Q&A panel. You may also dial 1-866-779-3239 and receive technical support assistance. During the presentation, all participants will remain in listen-only mode, and as a reminder, this event is being recorded for rebroadcast. I would now like to introduce your moderator for today, Donna Jacobs. Donna, you now have the floor.
Thank you, Peter. Thank you so much. Good afternoon, everyone, and welcome to Let's Talk About Health, a community conversation. This conversation is a part of an ongoing series that we produce at the University of Maryland Medical System for our communities. I am, as Peter said, Donna Jacobs. I'm Senior Vice President at the University of Maryland Medical System, and I will moderate this program today. Our Let's Talk About Health series is designed to increase awareness about important health issues, to provide people with tools to help them stay healthy or improve their health, and to create better, more robust conversations between medical providers and patients. Today's topic is fall prevention, not fall as in the season we're about to enter, but to keep someone from falling and from suffering great injury. Leading our conversation today, thankfully, is Buffy Wilkinson. She is the lead physical therapist at the University of Maryland, Charles Regional Rehabilitation in La Plata, Maryland, down in Southern Maryland. She received a doctorate in physical therapy from Slippery Rock University in Pennsylvania. She focuses on orthopedic physical therapy, and she's she's certified in lymphedema therapist, as a lymphedema therapist, which means she treats patients with breast cancer and upper extremity lymphedema. Before we get started, some of which Peter mentioned, just a couple of points for you, logistical points. This is a virtual conversation, but we do want your questions and input. If you have a question that you'd like to have addressed, please feel free to put it in the Q&A box, the question and answer box, not in the chat box. And Dr. Wilkinson will be happy to answer as many of those as time permits. The slides that you'll see will be available to you in a few days, and I'll give you more information on that. And as well, you will be able to review this presentation again, and again, more information on that. Dr. Wilkinson, I call you doctor because you've earned that doctorate degree. Please get us started. Thank you so much.
Thanks, Donna. I appreciate the introduction. I'm very happy to be here today to talk about fall prevention. It is such an important topic. Millions of people fall every year, and it can cost $40 to $50 billion every year for those people that do fall. So it's a very important topic. So if you can learn a few things or pick up a few tips from what I have to say today, I am thrilled. The University of Maryland, as Donna was kind of talking about, has developed this program around the Ask Me 3 program. It's 3 questions that you can ask your healthcare provider to kind of keep you on track when you go into an office. It helps you to be able to start the conversation with your healthcare provider, because who hasn't gone into a healthcare provider before and you just totally forget what questions you have to ask them. So it's 3 questions. It's, what is my problem? What do I need to do about it? And why is it important for me to do this? So those are the 3 questions that we're revolving this around. And it's so important these days to be proactive with your healthcare that these questions just help you to be able to do that. So I would like to return to these questions in a few minutes once I've given you a few information about fall prevention. So if you wouldn't mind, thank you. A few facts about fall prevention. 1 out of 5 falls can cause serious injury. And not only that, but as I said, 3 million older people can be treated in the emergency department due to falls every year. So that's a huge number. And more than 95% of hip fractures are caused by falls, and usually they're sideways. So you can see this is a big problem and it's an important topic. So if you wouldn't mind. So next, I would like to go over the physical systems that help to decrease your risk of falls. So the first one is vision. For me, if I don't have my glasses on, I'm probably going to fall within an hour. I can't see very well, so my glasses really help improve my vision. The other thing to think about with vision is there enough light in the middle of the night when you're going to go to the bathroom? If you don't have a light on, you've taken that vision system away and you can't, and you may have a difficult time seeing and you could possibly fall, which is a reason why lights are so important when you're going to the bathroom, to have a night light or some other source of light. Hearing, do you hear well enough to hear like your smoke alarm going off? That gives you more time to be able to exit somewhere to prevent injury or a fall. And it can just be your family members starting to notice that you're not hearing as well. It's important to get that checked. And not only that, but with hearing, it's also how well your inner ear works. Sometimes people have vertigo, which is they're getting dizzy at times. And there's lots of other reasons to cause dizziness, but hearing is just one of them. So, obviously, if for whatever the reason is, you are feeling dizzy or lightheaded at times, going to a medical professional and having them take a look at why that's happening. Because if you do let it go, sometimes you can fall and get seriously injured. So that's important. Another thing to think about is your strength. Are you noticing that you're starting to catch your foot on the floor more than you ever have? Or are you having a hard time kind of walking across a room that's never been difficult for you before? These kind of changes should give you some kind of alert that I need to have this checked out. Don't say, maybe it'll get better in a week, because in that time you could fall or whatever's causing this issue could get worse and you could have other issues. So making sure that when you're seeing deficits occurring, you're getting help. Light touch sensation. So, can you feel well on the bottom of your feet? Do you have like a peripheral neuropathy that's making you not be able to feel that light touch? That's really important to know. So if any of these systems aren't working well, it can put you at an increased risk for falling. So if you wouldn't mind doing, good. So these are some things that I was thinking of, and it's by no means all-inclusive list of, why you could have an increased risk for falls, different events kind of thing. So diabetes, just having talked about light touch, people who have diabetes sometimes can have decreased sensation on the bottom of their feet. So, if you're thinking, you're walking on an even surface and then all of a sudden you step off into the grass, are you able to tell that that's changed? So that's important to do. Recent medical events or hospitalization. So have you been in the hospital for 3 or 4 days and maybe you're not as strong as you used to be? Once you get home, maybe you're a little disoriented, so sometimes having somebody there to help you out once you get home can help prevent a risk of falls. So those are important things to keep in mind. Another one is, has there been any kind of change to your medication or drugs that a doctor has prescribed for you? If they've changed the dosage, then being aware that if something changes, maybe you are a little bit dizzy, maybe you are a little bit more off balance. Well, why is that happening? Maybe it's because your medication has been changed. So making sure that you're on the phone to the doctor and letting him know what's going on, or to the pharmacist, so that they can address those issues for you and make sure that you're safe. Changes to your sleeping environment. Are you spending the night at your daughter or son's house, and their bedroom is set up totally different? We're sort of hardwired, especially in the middle of the night when you're tired, to take that normal pattern to the bathroom. So if it's set up differently, maybe there's a table in your way now that you may trip over. So being aware that if you do change your sleeping environment, just to be cautious. Incontinence, feeling like you have to rush to the bathroom, sometimes that can give you an increased risk for falls. If you do have any issues with vertigo or dizziness, make sure that they're addressed and try to get a resolution for that, because that can put you at an increased risk for falls. Urinary tract infections. So sometimes an effect of that is that sometimes you're a little bit more confused than you used to be. So this is just as important for the individual who has a urinary tract infection as it is for the person that may live with them, whether it's a caretaker, a loved one, a spouse, whomever. If you're noticing somebody's having any of these kind of issues, sometimes we don't realize that we ourselves are having a problem, that we're tripping on the floor a little bit. The body's great at compensating. So, if you're able to notice that of a loved one and let them know and have them see another healthcare professional that can help them resolve it, that's very important, and it can help to keep them safe. So it's something to keep in mind. Next slide, please. So now we're coming back to the Ask Me 3 program. So the problem, you may already know what kind of problem you're having, with the fall risk, or you may not. You may just know symptoms of the problem. So you go to the doctor and you ask, or the healthcare professional, and ask, what is my problem? And you talk to them and you tell them what has been happening. So sometimes writing those things down ahead of time is a big help. And then what do I need to do about it? So once they've kind of investigated and talked to you about these different things, they may suggest that you go and get your vision checked. Or they may suggest you come see somebody like me who can evaluate if your legs are having some kind of weakness, if you're having some kind of motor control problem, if maybe you have a vestibular issue. And there's therapists that deal with vestibular or inner ear issues, like with the vertigo, and they can help you out sometimes. So when you see that healthcare professional, they can help you decide what you need to do. And why is this important to me? So, you're in the office and you're kind of like, I don't really need to go and get my vision checked. It'll be okay. Well, 3 million people fall and end up in the emergency department every year. So, it is a big issue and it needs to be addressed. And it can also help to resolve some other medical issue that may be underlying if you go and have this addressed. So it's to your benefit not to put off these things, to be proactive. Next slide, please. All right, so now I'm going to go through some general room safety. A lot of this stuff is common sense, but I always feel like it's never a bad thing to review. So that when you're walking through your house or your mom or dad's house today or tomorrow, and you're like, oh yeah, we should probably take care of this now. So for the general room safety, making sure that all cords are out of the way. That's pretty self-explanatory. Making sure that the entrance to the room is low enough not to trip. So sometimes door jambs can be like an inch or two up, and sometimes people can catch their feet on it. So if there is any way that you can level it out, maybe you have a handy person in your family. It's always good to have one of those, and they can do that for you and make it so that your toes aren't kind of catching on it. Throw rugs are removed or tacked down. Furniture is arranged or moved to have a clear path. Sometimes people don't realize how much stuff you have in a room until you kind of take a look at it. Sometimes there's just too much clutter. And sometimes just, removing a few things can make it much safer for you or for a loved one. So taking a look at it and trying to figure out the best way to make it nice and safe. All doors should open easily. I remember walking into a lady's house, and we were going from the garage into the living room, and it was 3 steps up, and it was this huge, heavy door, and the lady was probably in her 70s. And I was like, oh my gosh, and she had a bag of groceries in the other arm. And immediately I'm like, fall risk. If she has to pull that door really hard and try to open it, and she's on steps and she's carrying something, at some point she's going to go backwards and fall. And it's not just the heaviness of the door, it's also, is it hard to open? Like, does the door swell in the summer? So you really have to yank it. Be careful of those things and try to get them fixed if you can, because they can cause falls over time. Next one, please. Okay, bathroom safety. I put these couple of pictures on here just to make sure that people are aware that these things are available, because sometimes people don't know. So hopefully this will help. I think everybody should have grab bars in their bathroom. of any age, I think it's a no-brainer. Who hasn't slipped in the bathroom? So, if you have them near the toilet or in the shower so that you have a bar to hold on to, it just makes sense. An elevated toilet seat, and that's the picture on the bottom left. It has the handles and it has the little bump up so you don't have to sit down as low. If any of you have had a hip replacement before, you know it's very helpful to be able to have an elevated toilet to help you get up and down. And then the handrails also make it a benefit. So you're not having to, pull from the towel rack and maybe you're going to pull it off the wall and fall backwards. Using a shower chair if needed. So they're nice. If you're finding you're having a hard time standing up through the duration of a shower, and it's pictured here to the right, maybe you put one of those in your shower and then you can sit down. And then if you have a handheld nozzle, you can use that to kind of shower off. It's very convenient. And it's more safe. And so then when you're done, you have the energy and the safety to walk out. So the shower chair is helpful at times. Installing some non-skid strips in the bathtub shower on the floor. Sometimes that's convenient, especially if you find the floor to be particularly slippery. And toiletries placed within easy reach. Sometimes people find it nice to have like a caddy on the door into the bath, or I guess it's out of the bathroom. So it would be on that side of the door to put your toiletries in. So you don't have to go into a cabinet or bend down all the time to get these things that you might need. So some of those things help increase safety. Next room, please. All right, so the kitchen. I put a picture of this reacher here, and it could have gone into any room. It's called a reacher. It has a little trigger on it, and it would be this way if you're looking at the picture. And you pull the trigger, and the pinchers grab. So if you're having a hard time bending over to pick up things, you can use it to pick things up off the floor. Or if there's something light in your kitchen, like a spice jar or something like spice, little spice thing, you can use that to grab it. It's a handy tool to have if you're having issues, and it's called a reacher. So those are easy to find anywhere. So in the kitchen, frequently used items should be within easy reach, like on the countertop or in the front of the cabinet, just so you don't have to go climbing up on things and reach all over the place. Leave the most frequently used skillet clean and on the stove. I use the same skillet probably 75% of the time. If you have back problems or for some reason you get dizzy every time you bend over to get something, why not just put it on the stove? And that way you don't have to. It doesn't look bad. People just aren't used to doing it. The reacher can help and clean up spills immediately. Sometimes you're going to get something done and maybe you knock something over and it spills and you're like, I'll be right back. But then you get distracted with somebody else and maybe somebody comes behind you and they end up slipping. So, just try to take care of things as they come. Try not to use a step stool, but if you have to, they do have ones that have rails on them, and sometimes they can be handy to give you a little bit better balance. Next one, please. Thank you. Bedroom safety. So again, a couple of things that you may or may not know about. One is it kind of looks like an upside down rake, but it's much bigger. It's kind of bigger than that. It's actually a grab bar pole. You can have somebody bolt it into your floor and it would go next to your bed, or it could go next to your couch or somewhere that you need to get up from. And you can use it to pull on to help you stand up if you're having difficulty. So that's a handy thing. And then the other thing is a bed assist rail. And the horizontal part goes between the mattresses. And then the loopy part is kind of like the bed rail. So sometimes to put it up kind of underneath your armpit, just below that area at your side, and then it serves as a bed rail during the night. But then you can also use the handles to kind of help you to sit up if you're having difficulty sitting up out of bed. You can use it to help steady yourself while you're sitting on the side of the bed. So if you do get lightheaded or dizzy when you change positions, which happens to a lot of people, this can help you just kind of steady yourself and then take your time, let your head kind of settle, and then you can stand up when you're ready. So it's kind of a handy device to have. Having a place to sit and get dressed easily. Some people will have, some kind of like a dining room chair in their room because it's sturdy, it's not too low. It usually works well. Or they may have like a trunk at the end of their bed to sit on to make it a little bit easier to get dressed, especially if you're finding, for whatever reason, you're having a hard time kind of getting dressed like you used to, where you used to stand and put in one leg at a time. But if you're also noticing that, that is a change, and you should probably let somebody know about that. And don't just, never on any of these say, it's just because I'm getting older. It drives me crazy when people say that. Just because you're getting older, it doesn't mean these things are normal. And do what you can to try to fix them instead of just accepting what it is. So yeah. Oh, and the bed height being too high or too low. Good gosh, do people have high beds these days? It always amazes me. Some people are actually using step stools to get into their beds. So if you're using a step stool to get into your bed, when you get out, if you're a little bit dizzy, like happens to a lot of people, at some point, I have to imagine you're going to go sliding right out of that bed and onto the floor. But too low can also be a problem because if your knees have a lot of arthritis in them, sometimes it's hard to stand up from a low bed. So, trying to figure out, hopefully, again, you have somebody handy in your house or, a child or something that can help you out and can fix that for you, because that is a problem. Okay, next slide, please. Thank you. All right, stair safety. I think a lot of people know about stair safety at this point, but again, everybody should have handrails. I've slid down the stairs before. It can happen to anyone at any time. So have handrails to make you more safe. Having the edge of the step be more easily visible, whether maybe it's not the prettiest thing in the world, but maybe you paint the edge of the step with a different color so you can see the difference. And if your vision is not as good as it used to be, it can be important because it does put you at an increased risk of falls if you cannot tell where the step starts and where it ends. Tack down any loose carpets or boards. This makes sense. So if you are having difficulty going up or down stairs, here's a couple tips to make it a little bit easier for you, with also the thought that just because this makes it easier for you doesn't mean you shouldn't have somebody check it out. So if your right knee's bothering you and you're having a lot of pain, a lot of times it's easier to go up the stairs with the stronger leg, which in that case would be your left leg. So the left leg pulls you up to the next step, and usually that makes the right knee not hurt anymore because that's the side that does hurt, and you can use the railings. So usually you go up with what we call sort of the good leg, the uninvolved leg, and then you come down the stairs leading with the injured side, because then that lets you lower yourself down with the good leg, the stronger leg. So you go up with the good and sort of down with the bad is the short phrase version that we tend to use. Okay, next slide, please. So organizing your medications into 7-day supply containers. I think this is so important, and I think everybody should do this if you take medications regularly, because who hasn't, gone through the first couple hours in the morning and been like, did I take my medicine? And you're thinking about it and hemming and hawing a little bit about whether you took your medication or not. And then what do? Do you not take it? And that could give you issues. Maybe it makes you lightheaded or dizzy, or do you possibly double dose, which could cause you other issues? If you have these, pre-filled medication containers, you just need to look and see if it's in there or not, and if you've taken your medicine. So I think that's a really important and handy thing. Having life alert. So, you can have a life alert where you have a button, or these days, good gosh, there's so many different ways to do it. You can, call from your watch, cell phones. How easy is it to call 911 at this time these days? So if that's the way you choose to go, just make sure that you're keeping it with you, that it's easily accessible. Having a working smoke detector, again, just to give you more time to get out of the house if there is an emergency. So again, check your batteries every 6 months is the name of the game. Keeping the garbage and recycling area well lit and clear of clutter to make it safe. Use appropriate assistive devices like a cane or a walker. People all the time, I don't want to use a cane. I'm not going to use it. And you're like, really? You're not going to use it? It's really to your best benefit if you're having issues, and you're feeling unsteady. It may be to your best benefit to use a cane or a walker. You may talk to your healthcare provider about it. They may refer you to a therapist, physical therapist. We can help you assess if you need one or not. It's better to use a cane and you think other people think you look older than to not and to fall. And honestly, if you need a cane, you're probably not walking with the best technique anyway. And people are probably thinking you probably need one. So don't worry about what other people think. Be safe, be your own advocate, even to yourself. Wear good shoes and be careful of slip-ons. That's important too. Next slide, please. So tips to prevent falls. Speak up. That's sort of what this whole thing is about. Talk to your doctor about anything that's changing with your health. They want to know, they want to be able to help you. They want to help you before the problem gets bigger, and they want to help you before you fall. Have your vision and hearing checked as you're instructed to. That's sort of an easy one we all kind of know about. Be active. With your doctor's approval, exercise to your tolerance. Walk, do chair exercises, water aerobics, whatever you like to do. Walking is so important for everything having to do with your health. Visit your senior center if you have one. We have several down here that are just wonderful. They have many senior programs, many aerobic exercise programs, a lot of seminars that really benefit seniors. So check into them. Request to see a physical therapist if you're finding yourself to be getting weaker, losing your strength, stumbling more, or if you have some kind of dizziness that possibly could be helped by therapy. And you can always talk to your doctor about it too. They're usually pretty open to it. Next slide, please. All right, resources. So the CDC has a great website. It has lots of information on fall prevention, and that's listed here. National Institute on Aging has a lot of information about fall prevention, which is great. Again, senior centers are great resources. Primary care physicians are wonderful. Talk to them. Use the Ask Me three questions so you have yourself ready for what you need to talk about with them. But don't put it off. And the Maryland, I want to let people know the Maryland Department of Aging has a recycled, durable medical equipment program. It's not in every county, but it's worth checking into if you do need something. And it's not just walkers and crutches and canes and stuff. It can also sometimes be beds and stuff, and they're for free. So it's worth looking into if you're in need for something like that. And that's the information on that. So next slide, please. So that's
okay. That was great. That was really a great deal of very practical information, things we might not think about on an ordinary day, but can certainly keep us healthy and safe. So thank you for that. And if you don't mind, we do have some questions. They've been coming in.
okay.
Let me just say right at the outset, the first question that came in says, I live in a 55 plus condo community in Catonsville. Buffy is down in Southern Maryland. Can someone come and speak to our community on fall prevention? So I'm taking that one first because I want to give people time to get a piece of paper and a pen or pencil if you like. At the end, I'm going to give you the website where you can look at this presentation again, or you can certainly direct anyone whom you might like to send to see this presentation. So if you want to jot that website down, I'll give you time, and at the very end, I'll come back to it and say what that is. In the meantime, I would say to the person who posed that question, I see your name. It comes up with your question. And we should have your information available. We can reach out to you and talk about that if you want additional information as well. There are a few other questions that have come in. You spoke about the bed height, not too high and not too low. So
Yeah.
someone says, what is the ideal bed height?
I think what it would be that you can sit down comfortably as you turn to the bed. I would say maybe more than like a little bit more than a 90-degree bend in your knees. You know, if you're thinking of sitting down, would just a little bit more. So kind of just above kind of your thighs being parallel to the ground, kind of, if that makes sense. I haven't looked at specifics, but in my opinion, that would be what I would recommend people to do.
Right, and that's a fair understanding because you're saying where you can sit and have your legs at a 90-degree angle. If you're 6'5", that's
Right.
one height. If you're 4'11", that's a different height. So
Yes.
very particular. That's helpful. Here's another question. Any suggestions regarding slippery wood porches and decks? How do you keep them safe?
Yeah. I mean, you could try, I would think you could try the non-skid, there's non-skid tape that you can get. So you could put strips out at a certain increment to give you a little bit more tackiness. I would say also the footwear that you're choosing to wear, you know, maybe having something that has a little more tread on the bottom to give you more grip. And I think you can even find shoes these days that say non-slid shoes. So that might be something that you might want to look into to try to help with that. But that's a good question.
All right, here's a question that I hope you understand because it's not that I'm not sure I get, but it says, what is your recommendation about stair elevators? When are they the best choice? Maybe they mean stairs or elevator. I don't know.
I think what they mean is, and I'm hoping I'm right, is like the chair that you can put at the bottom of the stairs and it will take you up to the top of the stairs.
Mhm.
I think with those, you only want to go to them if it's absolutely needed, because once you start doing that amount of assist, you're probably going to start to get a bit weaker because you're not having to do that. So I would talk to a therapist about it, do a session of therapy, you know, go through a few weeks of therapy and see if you can get stronger to make stairs easier for whatever the issue is for why you can't go up and down them. And then once you've exhausted that, and found out, hopefully it works and it makes it easier for you to go up or down the stairs. But at times, for some people, it does come to the time where they do need one of those because they're unsafe. They can't do it by themselves and they cannot get to their bedroom anymore if you can't put a bedroom on the first floor, because sometimes that's an answer too.
So a related question about trying to get stronger.
Mhm.
Someone asked, if I start using a cane, will I need to use one forever? You spoke about people's reluctance to use a cane because
Yeah,
of how, the optics of it. So
right.
if somebody starts, do they keep it forever?
I think not necessarily, in my opinion. Sometimes you need a cane so you can, because a lot of times if something hurts, you're walking poorly, you're limping, you're doing something different. And sometimes using a cane to make your technique better so you don't have to limp, so you're not having as much pain, can decrease the pain. And then hopefully you'd be able to, you know, get rid of the cane over time. But if you're walking poorly, you may need to see a physical therapist to try to figure out why. So you can figure out what is weak and what needs to be improved, so that you can get off the cane if you feel you need to.
So here's a question here. Once someone has fallen, are they more likely to fall again in the future?
Yes, you're 50% more likely to fall again once you have fallen once. So, you know, if you have fallen, make sure you let your doctor know. You know, obviously sometimes we trip and we fall and it's like, oops, you know, that was just silly. But at other times, there may be an issue going on that you need to discuss with your doctor. So make sure that you do.
Early in the presentation, I'll say this for all of the listeners, Buffy talked about the Ask Me 3 questions. And I know some people came in a little bit later, so I'll just say what they are again, since she just mentioned talking to your physician. And that is, what is, describing the nature of your concern. What is my problem? What's wrong with me? Or what's the issue? What do I do about it? And why is it important? If you keep those 3 questions in mind, your discussions with your healthcare provider are probably going to be much more beneficial to you, and you'll get better answers. So what's the problem? What do I do about it? And why is it important? Here's a question about asking you about the statistics on falls on carpet versus hardwood floors. And I don't know if you know the statistics, but I guess the point is, are you more likely to fall on a carpet or hardwood floors? And should we be more concerned about one over the other?
That's an interesting question. I don't think I've ever been asked that one before. Each can be their own problem. So it sort of depends what the individual's problem is too. Sometimes carpet can be grabby, sort of, and it can kind of grab your feet. And as you're walking, especially if you're not able to lift your feet up well and you're kind of catching the ground. So sometimes carpet can be bad for that reason. And obviously, being very careful of small carpets and making sure that people aren't catching their foot on those. Wood floors, I would say they're probably a bit better. But just knowing that if it does happen to be slippery, maybe you do wear shoes at times if you're finding it to be so.
I was going to say wood floors might be a little bit better if you're not in socks, right?
Right. Yes. But even the socks, I love the hospital socks that you get that have the grabbers on the bottom. Those are great.
Sure. So. You mentioned vertigo a minute ago, and here's the question. I suffer from vertigo and have a walker. Is there something else I can use to prevent myself from falling when I have an episode?
I mean, a walker is a good thing. My thought would be, have you ever seen a vestibular therapist or attempted to be treated for that vertigo before? It's a very specialized area of PT. So you really have to, if you're calling around wherever you are, you really have to ask if they have a vestibular therapist. But sometimes they can be extremely beneficial to help with that vertigo. But I mean, I think just being, I think a walker is probably the only thing that you have, like when you're up and moving, but just being super careful if you are having an episode of vertigo. And maybe you don't do as much as you normally would, and you have somebody there that can help you to be safe while you're having it. So
that's great. You mentioned trying to get stronger, and someone asked particularly, as we get older, are there particular exercises or activities that we should focus on to maintain strength and reduce the risk of falls?
Yeah, I think it sort of depends on your activity level and what you like to do. I can tell you 10 different exercises laying down that you should do, but if you don't like to do laying down exercises, you're not going to do them. So do you like to do water aerobics? Water aerobics is low impact. It's easier on the joints. It's a great exercise to get stronger. Chair exercises. You can find some videos a lot of time online of doing chair exercises. So you're sitting in the chair and you're moving your arms and doing whatever with your legs. Sometimes people like to do those, and they can help you get a bit stronger. So it sort of depends on what you like to do. Go for a walk. Walking is a great way to get stronger and stay healthy. So figure out what you like to do and then try to go from there. So
would you particularly recommend exercises that strengthen your quadriceps, your quads?
Yeah, I mean, a lot of times people do need to get stronger in their quadriceps and in their butt muscles if they're having a hard time standing up. So I mean, certainly they're main muscles to help us move. So yes, at times it's certainly a good idea to have them be stronger. But also with strength, you need flexibility too. So it's a combination of those two things that a lot of times people need.
Is there anyone that can come to my home to assess it for fall risk and safety? I know there are some services out there that do that.
Yeah.
You know how somebody would find that?
I am not sure. I have done it at one point a while ago, I worked at a nursing home. And before that patient was discharged, we would go home and do a fall assessment with them. But I am not sure and there's home health physical therapy, but usually they're not going to come out and do a home assessment just for that. So I would have to look into that and see if there are any businesses that offer that to people. I'm not sure offhand.
Yeah. Well, let me say again, at the end, I'm trying to write down the questions that we want to come back to, and we'll try to post some answers, maybe not in the next couple of days, but later to some of these questions once we look further into them.
Definitely.
All right. Let's see. I fell in front of my home yesterday on the white gravel around foliage, scraped my arm, which bled a bit. Ended up pulling myself up, grabbing and holding on to the trunk of a bush.
Okay.
Mary, any thoughts?
I'm sorry about that. So, I mean, you know, I would need a little bit more information. Why did you fall? Did you catch your foot on something? Did you get dizzy? You know, you say gravel. Is it loose gravel? Do you have another way out of your house that maybe is more stable? Like, can you go through a garage or something that might be better? So that, you know, those are a couple things to think about. So hopefully that answers your question.
Well,
I'm sorry that you fell, though. I hope you're okay.
Yeah. So more questions about exercises. So everybody's now going to go out and do a little something. Check with your physician first.
Definitely. Yes.
Because what leg exercises? What about riding a bike, squats? I'm sure both of those are excellent. Do they cause...
Riding a bike is, I'm sorry, riding a bike is kind of like water aerobics and walking. It's a low impact exercise that tends to be good for a more amount of people. But yes, always getting cleared by your physician that it's okay for you to exercise. Sorry.
Let me say, this has multiple parts to it. Do these exercises strengthen or cause deterioration? And then they go on to say, I exercise every day. Should I have rest in between? I really opt for daily exercise. So do they strengthen or cause deterioration? Let's start there.
You sort of have to think of the type of exercise that you're doing. So the lower impact exercises like the biking or the water aerobics or a lot of time walking are lower impact. They're easier on your joints and less likely to cause kind of further deterioration. But, you know, so if you were to run, that's more impact. It's more on your joints, more pressure on your joints. So it's more likely to cause deterioration, especially if it's something that you don't usually do. You know, high impact aerobics, you know, where you're actually jumping around and doing stuff, more impact, you know, more likely to cause a little bit more deterioration than the other things. So I think that answers the question.
Yeah. Yes, here's an interesting question that, not that they all haven't been interesting, but this is a different sort of question. Is there a benefit to using trekking poles while walking outdoors?
Yeah,
or on uneven terrain versus a cane or a walking staff?
A lot of people like the trekking poles. It just gives you 2 more points of stability as you're walking. And what they are, it's almost like ski poles. And you usually have 2 of them. It looks just a little different, but as you're walking, you just put them on the ground. So it gives you more stability. So if you are having issues with balance and you like to use them, it might be a good thing to try. I think they've become much more popular lately. So people do tend to use them more than they
they're longer than ski poles as well, right?
Yeah.
So you're not reaching down. Good.
Yeah. Yep.
Someone commented that there are classes about how to fall safely. Are they worthwhile? Are you familiar with that? Are they worthwhile?
I think they are. And there are different kind of programs too for fall prevention. So yes, there is an art to falling. And if you are able to protect certain areas, sometimes that is beneficial. So, I'm not sure about all of the programs. You may have to do a little research and make sure that you're finding one that's has a good review and reputation. But there is an art to falling. Yes.
So, here's an admonition from one of our listeners, which says sometimes cleaning people use Swiffer objects or other things that shine the floor, and they can be really slippery. So be careful following that. I think that's a good comment.
Yes, I agree. That is a good comment. Yes, be careful of that.
Oh, someone said, do you know of any pill reminders that connect to a service that will remind you if you missed a dose? I would imagine you could do it on your smartphone. There's probably an app for that somewhere.
Yeah, you could probably just like set a daily alarm to go off at whatever time you want to take it. And you can just, wait till the alarm, and then when it goes off, take it, and then you've done it. You could, however, if you need to take pills twice a day, you could set an alarm for the morning time and an alarm for the evening time. I don't know any specific apps. Maybe somebody should make one.
There are a couple of shares here, and one says, if I'm not mistaken, I think there are some senior centers that have a service for home assessments against fall, which is a great idea. Contacting senior centers in your community, as well as the Department of Aging locally, you probably would get some pretty good information. And then someone says, I'm not trying to take over, but I'm attending the Howard County Office on Aging, and they do offer in-home service assessments as well as fall prevention focused on exercise classes, which is great. So
yeah,
that's the health department as well, and the Office on Aging.
So yeah, that's wonderful. Great, thank you.
Now, we've got a bunch of really smart listeners here.
They
because
are. I love these things when everybody can work together.
Someone said that some pharmacies offer reminders for medicine, so it's worth asking your local pharmacist as well. Well, Buffy, I think that's the end of the questions. This has been really great. Again, some very, very good information. And let me go ahead and share with everyone the website. So as I mentioned at the very top, today's session is a part of a series. We ran many last fiscal year, and we're starting up again for the new year. You can see the topics that we've spoken about down there at the bottom, from men's health, women's health, children's health, asthma, stroke prevention, etc. And we'll be picking up more in the future. But if you'd like to look at this presentation again or share it with someone, here's the website that I promised. You can do so in about 48 hours by going to www.umms.org/let's talk. So you'll there be able to see this session as well as any of the prior sessions as we move forward. Next month, as is in keeping with us, on the third Wednesday of the month at noon is when we do these. Next month's topic will be about domestic violence, and you may want to tune in. If you were here present today, you'll get an invitation to that, as well as if you've been present in any of our prior sessions. That invitation will come automatically, but you may just want to share that with folks. So it'll be domestic violence next month. And again, you can look at this presentation, review it, listen to it again, and look at any of the slides. You can certainly screenshot any of those slides that you might like. I want to thank all of you for all of these questions. There are quite a few today, and for the advice that several of you shared. And certainly, Buffy, I want to thank you once again on behalf of all of us listeners for all that you imparted today and the very, very practical information. Thank you all, and have a great day.